And there's definitely a lot of you. 8:42. It is Monday, the 20th day of April. I just had a message from one of my friends.
What?
Worst 420 ever. Because it
is 420.
Yeah, it is 420, and the only reason why it would be a thing is because of course, marijuana has been legalized, and it was supposed to be by this point that they had done all the rules and regulations up. But obviously, I don't even know backseat. I mean, it's like way back of in a van, the last priority right now. But I wanted to get Will Parkinson from the Cannabis Board. Maybe we'll get him on this week and just kind of talk about it. It's 8:43. Tomas Manglona from the CNMI on the line now. Good morning, Tomas.
Good morning, Bree and Chris. How are you?
We're doing pretty good. There's a lot of stuff that happened over the weekend that we want to ask you about, but first, of course, we'll give you the floor and here with the latest on the COVID-19 response and developments in the Northern Marianas. Tomas Manglona. Good morning, Tomas.
Good morning. So, as Bree said there, one new COVID-19 confirmed case in the CNMI. This is the first case to be confirmed at the CHCC laboratory. It's of a 57-year-old female, and that female is in stable condition and is safely isolated at Kanoa Resort, according to the CNMI Governor's Office. This brings the CNMI's total confirmed cases as of yesterday to 14. This new case was confirmed at CHCC laboratory using a newly acquired testing device, ID Now by Abbott and Alere. The ID Now COVID-19 is now available for use under the U.S. Food and Drug Administration Emergency Use Authorization. Results can come in as little as 5 minutes, according to the Governor's Office. The CNMI Governor's Office also sharing that they will continue to send specimens that fall within other testing priorities off island until the CNMI can get other testing platforms for the overall testing strategy. They add that CHCC, with the Governor's COVID-19 task force, has beaten its proposed timeline by 2 weeks with this FDA-approved platform. Also on Saturday, 5,000 additional test kits arrived on island from South Korea. This means that the CNMI is now waiting for the remaining 35,000 more. On island, we now have 25,000 test kits from South Korea. In that same announcement, the governor also saying that construction continues on the alternate care site at Kanoa Resort Hotel on Saipan. Torres also saying that the NMI task force will be meeting to discuss detailed projections for cases on island in an effort to flatten the curve. The governor's office saying that they will also continue to send specimens off island as CHCC continues to prepare for the CNMI's community-based testing strategy at the end of this week and the early start of next week. And just to remind folks, priority 1 testing, according to the guidelines followed by the Commonwealth Healthcare Corporation on island, is for patients and healthcare facility workers with symptoms at the hospital or alternate care sites. And Bree and Chris, we're also working to speak with that Saipan doctor who, is being also using these test kits, and as they continue to schedule the community-based testing with those thousands of kits that we now have.
Mm-hmm. Hey, are you hearing anything about the, I know that the governor mentioned it briefly in his Facebook post over the weekend about this, how they're working with the CHCC, and it sounded like they were going to be issuing some sort of a trajectory for the CNMI.
Yes, that's correct. Other than what was mentioned in the Facebook video that he posted, there isn't much else we know right now. I know for the CNMI, most of the projections have come by FEMA through the by way of U.S. Congressman for the NMI, Kilili. And so far, that's the latest projections we saw. We spoke with Kilili last week, and he spoke about those projections. Mm-hmm. And we're going to continue to follow up and see if those numbers are going to be released to the public, because I know folks are, concerned about that. I should also say that I went ahead and followed up with the CEO herself this morning to confirm that 9 are recovered in the CNMI and 3 are stable condition. So those are the statuses of the confirmed cases we have.
931, and there was 2 deaths there, right?
Yeah.
Okay,
so
that makes the 14. Yeah.
Yeah, because we want to, we heard that the most recent case was stable, so I wanted to follow up on the 2 that were announced prior. So she says 3 are stable. So.
Okay. Tomas, I know you had mentioned that there is that discussion to conduct the mass testing We're
Yeah.
getting some comments here. How far along are those talks, and are we going to see something to that effect maybe this week, or what can you tell us more about
Yeah,
that?
and so we spoke to Esther Munia last week, and she said 2 weeks from now. And then this morning we were talking, and they're actually starting to schedule those tests. And so they're calling it community-based testing. As she was explaining to us earlier, and as we reported, this is done as a public health, effort because. For the test from South Korea, and we're going to follow up on the logistics again. We're not necessarily sure if this is a drive-through or if this is a village by village, but these are things that we're expecting to hear, as early as tomorrow, we hope, or later this week. We definitely know that they said that, and they're also still waiting for the 35,000 more. So I'm not sure what their plan is in terms of rationing out all those tests.
Were you able to hear a conversation with Frank Mansell of FEMA?
I heard a bit of it. What part of it exactly?
Well, he was talking about these South Korean test kits and how if states are ordering them and ordering large quantities, the assumption is, and also he said this about the NMI's case, that they are going to be reimbursable expenses.
Yeah, and that's what the CNMI governor's office told us. We're working on to get the cost for that. We know 60,000 is not a small number by any measure. That's the entire population practically, and so. I think that, I think also just to add more context, I think there was about 3 or 4 South Korean manufacturers who are contracted. So this one from Solgen is just one of them. I know looking at other national media reports, other cities across America are getting South Korean test kits from the, one of the 4 manufacturers that got that preliminary approval. So South Korean test kits come from those different manufacturers, as we said.
Right, and so what Frank had said was that if there was a request made by the governor of Guam, that would probably also be. So, I mean, we'll see if it develops.
Right. That's yeah, definitely, and hopefully, a lot of folks want to know when, are asking the question, when can I get tested? So, I think that question will be answered later.
Yeah, I think that is interesting to see how logistically this is all going to play out when you do mass testing. So
yeah, I heard someone on your show last week. I'm not sure if you remember, but someone said it would take about 100 people a day to do this. I'm not sure which doctor said that.
I think Dr. Cabrero was talking about it. It depends on like the machines, I guess, how many you can run, right?
Yeah.
And so how long will it take? Because you have 20,000, you can only run 100 a day. That's going to take you X amount of days and months to actually go through all those tests.
Right, and again, just reiterating the hospital CEO, there's, they're working also, part of the effort is to also validate those South Korean test kits with the approved equipment. So I know the controversy continues in terms of, where and who and why.
Looks like we buy American here on Guam.
Oh, boy. Yeah.
Sorry.
Thank you, Tomas.
Yeah. Is there anything else you want to share what you're working on for today, Tomas?
Yeah, I'm just going to do that wrap up. We've got so many. I know also in the CNMI, there's the Commonwealth Bureau of Military Affairs announcing that the medical team, the deployment support is led by Brigadier General Tracy Smith on island to help. And so we know that there are lots of experts here now kind of monitoring all the developments. I think I should also note I think today marked 21 days since the last press briefing we've had by the governor and the task force. And so
you guys should send him a miss you card.
But we know that we continue to see those Facebook video updates and the graphics. But of course, as we've been saying, it would be nice to have all the media there to ask questions.
Of course, Tomas. But I mean, we're all dealing with it. We had some conversations last week of the same thing going on in Guam. I know we have our one press conference a day, but again, there are just way too many questions and not enough answers. So.
Yeah, and it's this week especially is a busy week. Hearing from some of the professionals doing this work, scheduling those community-based testings, or some people are calling it mass testings. That's elaborate and difficult. So I know a lot of the time is being spent on that right now.
We're getting the comments here. Glory writes in, can you imagine if the CNMI starts mass testing before Guam? And then someone else, Chester, writes, I think they will be way ahead. And then Jovange chimes in, it would be really so sad and embarrassing.
Yeah, and I think I was thinking about this because people are saying, oh, you might be fixated on these tests, but if you look at all the leading professionals, even at the national level, the number one thing they say we need to be doing is testing. So,
Testing, yeah.
So,
And you're right, and I think that if we're going to start talking about recovery, that's fine. But if we're going to take actual steps towards recovery, then I think we need to do the. I mean, if you look at any jurisdiction that's dealing with COVID, South Korea included, how did they kind of get around that curve? Is by conducting the mass testing.
Right.
Yep.
Yeah, and
Test.
hopefully we get that soon and get some video out of the CNMI.
I like it though. I like that you guys are. To me, I think you guys are a little bit ahead of Guam in your response. I mean, it looks like you guys are actually looking for people to test, whereas on Guam we're testing as few people as possible based on the criteria. But I love it.
There's commercial testing at DLS.
There's commercial testing. No, I'm just saying, but when you bring it
I know
up,
what you're saying.
it's always a little weird. There's a couple media who they ask the governor these questions about, hey, CNMI is doing this, CNMI is doing that, and she gets like triggered about it, So obviously there's some kind of like rivalry. I'm pretty sure it's partisan maybe between the CNMI governor and the Guam governor, which is really unfortunate because I think we should be pooling our resources and our ideas together instead of like, no, you guys do your thing and we're not going to even know.
Yeah, and I don't think that's I don't think that's unique to us. You see a lot of reporters in different states saying Nevada did this, California did that, and I think the intention, my interpretation of that is that when citizens see other that what's possible, then they want to know that it's possible here too.
Exactly. I mean, we have a little thing called the internet, and you can go and look at things and see what other places. And it's really, I mean, we don't have to sit here and defend why we're asking the question. It's as simple as compare and contrast, which is just one of the most basic media principles. And I mean, people are doing it. It's not even the media. You see the comments. Everyone's like, "Why are they doing this? We're not doing that." So.
You know what I always, I've been thinking about this. What I think would have been really, really neat, because this is unprecedented times. If we just saw some of the former governors all came together and provide dialogue, see discussions with them, and in how do we get through this crisis. You have former Governor Carl Gutierrez. I think that question was asked by Adriana. You have former Governor Calvo, former Governor Felix Camacho. All of them have been through several disasters, and it would be and recovery. So I don't know. What do you think?
Seems like we got a lot of good minds that we should be using more of.
Yeah. Anyway, that was just something
definitely.
I thought about.
Yeah, Bree, that's interesting.
I told you guys.
I think provide some stability in a way.
And I'll tell you again, we did. Of course, we reached out to former Governor Carl Gutierrez, and the response he gave me was he wanted to respect that the governor was handling this public health emergency. And I really tried. I was like, man, Uncle Carl, you people want to hear from you. You got all this experience. You know what I mean? I mean.
PACA, Pongson Shata, and Asian Economic Crisis, KAL. It's a lot of experience. It
is, and I really, when we asked the governor about it Friday, Adriana asked about it. You got like a 20-second answer, like, yeah, he's around here somewhere, and they email him or whatever she said.
And I think we've covered every single one of those too.
We have, and when she named her Economic Recovery Council, she didn't name Uncle Carl on there.
Yeah, and I think for the NMIs, and we're waiting to see if something like that happens here as well.
Wow.
I think there might be some things in the works.
Well, did they indicate when that trajectory was going to be out?
No, they didn't. But based on, I don't know if they're going to be basing it on the same reports that the Congressman Kilili has been putting out. But I'm looking forward to seeing that published.
Okay.
All right, Tomas, thank you.
Be safe out there.
Thank you for working around all the barriers that you got out there. And, I mean, you're doing a great bang-up job. We're getting a lot of comments about the information you're putting out. So, I just wanted to start this week by patting you on the back, boy.
Oh, all right. Well, I don't want to see how the end of the week is going to be. Thanks, Chris.
Okay, Tomas.
Okay, bye.
Wash your hands.
Bye. Thank you.
Okay, Tomas Manglona. Man, love having him on the team. Let's keep with the phones. There was a letter that Senator Sabina Paris had put out.
Right.
And you got that up there?
Yeah,
somewhere around here.
I read it. I didn't read the whole letter.
Okay, we got her on the line. So if you want to just go over that, then I'll pop her up. 8:56. Also, we're going to get Ken Lujan.